back to the Talking with Taylor podcast, where we talk with anyone about anything, and hopefully everyone around the table will listen. We have a very special guest on our podcast today. She's a great friend of mine. Her name is Tiffany Oaks. She is a speech pathologist in Tennessee, and her husband is a dear friend of mine. We met at this thing called Tri-State Youth Choir about 5 years ago, and Seth and I have bonded and connected, and man, we just have a great friendship. And my wife Lindley knows Tiffany as well. We love this family, and I can't wait to interview her today on a topic that's very important called traumatic brain injury, also referred to as TBI. And Tiffany's going to go into that in more depth. As she is a speech pathologist, she has dealt with patients and treated patients with TBI in her field of study, in her professional field. And so we're going to ask her some questions and hopefully get the answers that we need to continue on. And if you're an athlete, because I know we have a lot of athletes that listen to this podcast, hopefully this will be informative and helpful for you as you continue on your athletic journey. But before we get started, before we bring Tiffany on, we have to thank our sponsor, and our sponsor helps make this possible. And this is our probably fourth or fifth week going. And our sponsor is, again, Rugged Boutique. And Rugged Boutique is located in Centerville, Alabama. But here's the deal. You don't have to live in Centerville to shop at Rugged Boutique. You can shop at Rugged Boutique at ruggedboutique.com, and you can save 10% on your purchase. My wife loves Rugged Boutique. You've got to go check it out. And so I know they've got, everyone has to wear a mask, and they've got these really, I guess you'd say, cute masks if you're trying to match your outfit. So you want to go check that out. So you can save 10% of that on that at ruggedboutique.com. Use the promo code Taylor and go check them out. Well, all right. Without further ado, we bring in the speech pathologist, Miss Tiffany Oaks. How are you doing, Tiffany?
I am well. How are you, Taylor?
I am doing well. I'll tell you, it was a sad year for me this year, not being able to see you and Seth in June for the past 5 years. So I was telling Seth, for the past 5 years, that has been my June. And that's been y'all's last how many years?
I was with the choir, or I have been with the choir for over 20. I think it's 21 years.
So
this is the first year in all of that we didn't get to go on the tour in the mission trip.
Oh my goodness. Well, that is, I can't imagine. I mean, for 5 years for me, it was just heartbreaking. And I can't imagine for 21 years. And I think we're going to interview Seth and Adam and Ben and maybe Miss Judy about the Tri-State at some point. So I think that would be really cool because it's a really unique story. But okay, so, I mentioned when I was introducing you, about your field as a speech pathologist, but tell me a little bit more about your background and where we're going to be going today when we talk about traumatic brain injury.
I am a speech language pathologist. I've worked mostly in the medical field, so I have worked with TBI and sports-related TBI. I was a student at the University of Tennessee, and my professor was Dr. Kristen King, is my professor in this field, and she is very published in matters of TBI and all cognition areas. So I'm pulling a lot from her. She was my professor. She taught me at UT and then did research on this at UT. And now she's currently my friend and my boss. So I let her know that I was going to be pulling some of her stuff and just doing a little bit of this. And she was okay with that.
Well, that's really cool. And, as an Alabama guy, we won't hold the Vols against you guys. I'm just kidding. We set that aside for this. So we always like to pick at each other. Now, when we go to Tri-State, the only other Alabama fan there is Melissa, right?
I know definitely Melissa. Surely there are more. I mean, it's a room full of kids. They like to go with the winning team. So.
That's true.
Surely there are more.
Well, hey, regardless of your team, it doesn't matter, what color your teams are. This is a very important topic. And so that your professor, I'm just thankful that, you guys have been able to take this on because from a former football player's perspective, I do believe in college it was treated well. In high school, it was, but we didn't have the technology. But before we get into all of that, for our listeners, can you explain what TBI is for those that might not know?
Like you said, TBI, it stands for a traumatic brain injury, and that sounds really bad to say traumatic brain injury, but that's a concussion. So mostly what we'll be talking about today is that mild TBI, which is like a concussion, a sports-related TBI, and that is any kind of dysfunction of the brain that happens, any kind of injury to the brain that happens from an outside force. So a knock, a blow, a bump, a jolt, whatever you want to call it, that is where it's coming from. So yes, a concussion is considered TBI. The thought that a concussion with sports is just kind of part of the game is really changing, and people are understanding now that it's a little bit more serious, and that's kind of how people should think, and what we kind of push for in the profession that treats it, that we look at it a little bit more seriously than just, well, it's just part of growing up. It's part of the game.
Right. And I will say, growing up in a small town, from little league football to, which is crazy, you start thinking in those really developmental years. Now, I don't have much study in this field at all, but here's the issue that we face a lot, I believe, which is a big problem, not just in the college and high school deal, but you got youth football with coaches out there who really don't know what they're talking about, who think just because they watch football on Saturday or play Madden or NCAA that they know how to coach, and they're missing where these young athletes are knocking head to head. And you got these young brains maybe suffering from TBI, minor TBI, and not even knowing it. And so is that something that you're seeing and that you guys have looked into?
It is something that needs to be trained from a young age, especially if you're doing sports as a young child. If we can kind of change those behaviors in the way that coaches and players, even young in little league situations, look at head injuries and how to respond to those and tackling strategies, if we can train those behaviors early, then we're not trying to undo damage or undo bad behaviors as they get into high school or college football or even pro football. If we can knock it out early, that helps. It's a good preventative measure.
For sure. And that, I think that needs to be a standard amongst youth coaches, saying, hey, just, old Joe and old Fred down the street don't just need to be coaching because, their kid or their nephew is on the team. There needs to be some kind of criteria for them to be out there teaching young athletes, because if they're teaching them wrong technique, if they're teaching them, to go head to head and knock heads, then that's a development. That's a habit that may stick with them for a while. And it's hard to recoach that when you get in middle school and high school. And so I think, we can address that if we address it at a young age. Hopefully that may carry over into middle school and high school. And so, since we kind of talked about TBI, what it is, and we dealt with the youth sports, who is at the highest risk for TBI?
In general, people who are young children and then older adults are usually the more susceptible to a TBI, but there are special allowances for athletes and like military service members where we see more concussions, more occupational or extracurricular related TBIs.
So mainly
everyone's at risk. Anyone can get a TBI.
Right.
But we do there are special allowances that we look for particularly military and sports related TBI.
So basically those are the highest at risk, but anyone can have one if you're in a car wreck or,
Yes.
I mean, if you're kind of like me, if you're a little clumsy and you slip and fall, anyone is, so that's a tough word I'm about to say, susceptible. Speech pathologist, help me here.
Yes.
Susceptible to a TBI. And yeah, so those that are at high risk, if you're an athlete playing sports, any kind of contact, you are at high risk. And I think it's important for not only coaches to educate themselves, but also for young athletes to educate themselves and know when to say something. I think that's important, because I feel like sometimes coaches, now I didn't have this experience in high school and in college, but I know some who have had this experience where they're afraid to say something about their injury because it may affect playing time, and so, but we were on the phone earlier and you said that you believe this is changing to some degree. Is that kind of what you guys are seeing, that this is changing in athletics?
It's getting better.
Okay.
The communication between players and coaches, as to, like you said, a little bit of afraid. I don't want to come out of the game. I don't want to look like I can't do it. But the communication is getting better. And as we're training coaching staff and the physical staff on the sidelines for football to recognize it and kind of pull a player out if they're having any of these symptoms, and just to check them out before they go back into the game. Like, that's getting better, but there's still work that needs to be done, especially on the side of the players, like you said, who will say, I'm afraid to say anything.
Right.
If they can feel more comfortable with the coaching staff to really be honest about any symptoms that they're feeling. I mean, you hear it, oh, they were shaken up on the play. Well, maybe we really ought to look at that before we stick them back in there for the next one.
Right. Right.
The player's a little bit more honest about, maybe I need to sit down a minute and talk to somebody, have somebody check me out. Then
For
that
sure.
would help.
For sure. And we were, going off that, we were discussing targeting on the way here,
Mm-hmm.
and the targeting deal. You see a lot, of when they get hit. Obviously, the one who enforces the hit is usually penalized and out for the game or a half,
Mm-hmm.
or whatever. But a lot of times, the guy that gets hit usually just goes back in, and
Mm-hmm.
that's where you were saying that they need to be looked at too. And so what is the what is some of the, I guess, what are some of the symptoms that a player can look for, or that, obviously the athletic training staff and the collegiate level, they're going to know the symptoms, they're going to know what to look for. But
Mm-hmm.
for maybe high school coaches and some of those players to diagnose themselves as they're trying to compete, what are some symptoms that they can look for?
First off, it can be a little bit delayed. It's not that you're immediately going to have these issues. So look for any kind of delayed symptoms as well. The big one that people look at is that loss of consciousness. It's, was I out? Did I black out? Did I wake up in a different room and I didn't know how I got there? So that's one that's pretty obvious, that people can recognize something that has changed and maybe that was an injury. There's also some confusion, there's blurry vision, difficulty with concentration or attention problems. If you're having any kind of post-traumatic amnesia where you've lost a bit of time,
Mm-hmm.
headaches, lightheadedness or dizziness, it's important to say, I feel a little bit dizzy on this. Maybe we need to sit down and look at that. Even like a ringing in the ear sometimes
Mm-hmm.
can happen. So those are some of the mild TBI symptoms, but they don't always just show up immediately. So that's
Right.
an important part of pulling somebody out and giving them a little bit of time to see if these symptoms are developing, to see if something is changing.
Okay, for sure, for sure. So that whole list there is something that athletes can kind of self-check themselves and say, hey,
Mm-hmm.
look, maybe this is where I might need to go tell coach this is what's happening, or go tell an athletic trainer. And even at the high school level, I'm seeing that, yes, they have athletic trainers. Not all schools are having them every day at practice, which in a game, they're going to have, most of the time, they're going to have an athletic trainer there. So at a game, that may be an easier, not an easier, but someone will be there on hand to go talk to, like an athletic trainer. But day to day at practice is where a lot of that's happening, not necessarily just in the game, because a lot of people just see the game and
Mm-hmm.
they see the big hits, but people forget Monday through Friday or Monday through Thursday that they're knocking each other out every single day, all the way up until the game. Now it may be a little delayed, but they're still, their heads are knocking heads, and it's a weekly thing. So hopefully we can see some high school coaches and middle school coaches uh, be more educated on this issue. And so, as we're talking about this, what are some of the long-term effects of TBI? Is that something that you guys have seen, and even in your speech pathology patients, is this something you've seen? What are some of the long-term effects you're seeing over time?
Long-term effects are going to be worse with repetitive TBI.
Hmm.
It's going to be something that if you didn't fully recover from one and then went right back into the game, or if you have had several over the course of whatever period of time, that's where it's going to get a little bit trickier. That's where it's going to get a little bit more dangerous. Like, I think in boxing, it's called punch drunk syndrome or
Okay.
something like that. So it's just kind of that buildup of symptoms over time with repetitive injuries. And there is, I would have to, I need to look up and see what it stands for. It's called a CTE. It's some kind of
Okay.
some kind of encephalopathy. And it's something that we see with repetitive mild TBI. And I mean, just how scared do you want to be? Like,
Right. Yeah.
At that point, it's becoming a progressive neurodegenerative disorder. And it is, and again, it's accumulation of these kind of injuries and the symptoms from these injuries, and it can show up even in earlier stages. There is let me think of his name, Allen, maybe, Dr. Allen?
Okay.
That did some research on this and has found that syndrome already beginning in as early as 25 for kids
Yeah.
who have looked at or have been starting sports from an early age and have had TBIs from an early age. That is something that he has seen from early. It's from 25, and that's progressive. That's going to stick with you.
Well,
traumatic encephalopathy. I looked it up here. The CTE is chronic traumatic encephalopathy.
Okay. That's a big word. I'm not going to try to repeat it, but I'll use the CTE.
Yeah.
Yeah, we'll go with CTE. Well, thinking on CTE, I don't know if I'm going to go Netflix for a second. The Aaron Hernandez story. Did you guys happen to watch that with Aaron Hernandez?
I have not seen it.
So do you know who Aaron Hernandez is?
Yes.
So they kind of go into that where, they now my reference is Netflix and YouTube on this, but they discuss that a lot of his issues that he faced was from CTE, from the, consistent, he played football at Florida. He played football for the Patriots, and they would relate a lot of what was going on in his mind and what was going on in his life to CTE. And you throw a kind of crazy childhood as well, and with that, I think that is almost a recipe for disaster for some of those guys.
Now, I've not seen that, so I didn't know that was something that had been discussed on what's, I understand to be a pretty popular program on Netflix, especially for the sports population. So I'm glad that got brought up, because CTE symptoms can involve just changes in behavior, personality changes, problems with reasoning. Yes. So that's something to look for. And he's a young guy, or was a young guy.
Yes.
So that shows you that, these repetitive injuries can have an effect early on. And that's not something that there's no cure for traumatic brain injury. We treat the symptoms, but there's no cure for it.
Well, see, that was going to be my next question is, how do we, is there a cure, but how do we treat it? How do we deal with it? How do we treat it when TBI is present?
There's, like I said, there's no cure. Prevention is the best medicine for this.
Yes.
If you sustain a head injury, one of the best things that you can do is really give yourself time to heal. Yeah. Make sure that you have recovered from that before you try to do any kind of going back into the game, starting a new game, going back in several plays later. Make sure that you're actually recovered. I think the general thought is 7 days for a mild TBI. Yes. That may not be exactly correct, but I think it's about 7 days is when we start to see some recovery from that. So that sounds like a long time, but compared to some of the long-term deficits that can happen from not letting your brain heal appropriately, it's not that bad. It's 7 days.
Right.
Out for 7 days. Now with the symptoms, we can treat the symptoms with the cognitive deficits that come up. Some, if it's cognition related, speech therapists can work on the memory, the attention, the problem solving, any kind of word finding problems that may come from TBI. If you're having trouble thinking of the words that you're trying to say, if it's sleep problems, you can consult your doctors about any kind of problems that you're having with sleep and headaches. So there are treatments for the symptoms, but we can't actually treat or cure the TBI itself.
It's just something that's going to be with athletes or with anyone who has a TBI.
Just let your brain rest and heal.
Yeah, for sure. Well, I'm going to get a little personal, I guess, on some of my concussions, I guess, and we can kind of play here. What should I have done, or did I do the right thing? So the only ones that I remember that I actually, that I don't really, I may have had one or two in college, but that's the problem. You get knocked, you get hit, and you're kind of dazed, and you just keep playing, right? So it wasn't the coach's fault. It wasn't the athletic trainer's fault, because I didn't tell anyone, right? You just get dazed, like, oh, I'm fine. But that may have been something, should that have been something that I would have needed to go talk to a trainer about or a coach about if I'm dazed for just a moment and back in?
Yeah, that's a danger with TBI in sports is that it can go undetected because a player will just shrug it off and keep going. And it's something that we need to look at, that schools and organizations are doing better about it, but we need to have a plan in place for what the communication needs to be if a player has any of these symptoms,
Right.
that they report it, and what the plan is going to be to assess that player as thoroughly as possible. Because sometimes you have maybe a little bit of a symptom or you feel better and you think you're okay, but if we did some testing or some actual imaging or a cognitive test, you're going to still see the errors. You're going to see the deficits as those pop up that you may not be reporting yourself.
Wow. Yeah. So the biggest thing is, hey, if you're listening, hey, say something, let someone know. And my last little concussion story. Now this one I was treated because I had no choice. I was a freshman in high school, and the guy was a senior. His name was Charles Conwell. All right. And so Charles Conwell sounds like a big bad dude just hearing his name. So Charles was playing fullback and I was playing middle linebacker, and we were doing a drill literally where we ran straight at each other, and then heads knocked, heads hit, and all I remember is I blacked out, and coaches, and my dad was a coach at the time too, saw me curl up in a ball, and I was just out cold. And the next thing I remember is waking up in the locker room and saying, when does practice start? And so and then they rushed me to the hospital, and I got there. And so a couple things thinking back to that is, hey, number one, what's a freshman going up against a huge senior anyways? And I get it. I was playing as a freshman, so I need to get prepared to, but maybe not necessarily that drill. And so I guess they took all the precautions, right? Get me to the hospital, all that. Is that, stuff that needed to happen immediately with a case that severe?
If you were having that big of an issue and that young, it's not going to be overkill to have you assessed at the hospital.
Right.
It's gonna be within the realm of reason to
Right.
get checked out. So
Right.
I'm in the South. I love sports too. I know that we want our boys to be tough and just get back out there, but that's something that needs to be looked at. So
Absolutely. Yeah.
you got all of the care that you needed with that one.
I think so. I think, well, okay, here's a question too about it. So I was always told, they tell you don't go to sleep, right? Why is that? What's the deal with that?
You're wanting to continue to monitor symptoms, and that loss
Okay.
of consciousness is one that it gets looked at a lot as to the severity of the brain injury. It gets looked at as is it more than 30 minutes of a loss of consciousness? Is it more than 2 hours? So we're trying to make sure that we're watching for any kind of symptoms like that. And we want your brain to be able to tell us what's going on in there and not just,
Yeah.
be able to say anything when you're going to be the one reporting those symptoms.
That's right. That's right. Well, Tiffany, hey, today has been awesome. It's been a great interview. And so if you could leave us with one statement about what you think as a community, as an athletic community, or just anyone in general, just kind of recap what are a few things that we can help prevent, to help treat, and to help educate athletes and everyone moving forward about TBI.
Education is the biggest one because we're looking at prevention. So we need to get the education on the forefront so that we can prevent these injuries. It's going to be education on communication between the players and the staff. As a parent, I have a young son. I'm going to make sure that if I get him involved in sports, his coach is going to be educated on what the signs of a TBI are and what needs to be done if something happens, if there's any kind of brain injury. So it's going to be education on all levels for any kind of staff or any kind of players for these sports, and making sure that we have the right protective equipment, that they're using it appropriately. It doesn't help if you just have it and you're not using it, so that we're using it. And like you said, that's not just in games, that's in practices. So this isn't something that needs to turn on Friday or Saturday or whenever the game is. This is something that needs to be thought of 7 days a week whenever you're having those games or practices or any kind of interactions with your players.
Well, for sure, Tiffany, for sure. Well, Tiffany, thank you so much for being on the Talking with Taylor podcast. You did a great job.
Well, thank
And
you.
it's always good to see you. And tell Seth I said hello. And guys, thank you so much for listening to the Talking with Taylor podcast.